All right. So, REAIM is a framework that originally began for the purpose of translating research to practice. And so it's been used in a variety of different fields, disease management, physical activity, obesity. And so as I was learning more about it and thinking about it, using it through evaluation, I think it has a lot of potential for prevention work as well. And so that was the reason I wanted to share it with you all, to get your input to think about how we might use or adapt this framework in our work. So by the end of the roundtable today, we're hoping that you all will be able to describe the REAIM framework for evaluating public health initiatives, discuss ways that we might adapt it for substance abuse prevention, and then critique the pros and cons of the framework. Because I think, as with any framework or model, it's not perfect, so there's room for discussion around what we like or don't like about it. And after the presentation, here are some questions that I wanted you to think about that we can discuss further. So just your overall impression of the model, any of the positive or negatives that you perceive, how you might use it in your work, and some of the challenges to using it in prevention. So we'll come back to those afterwards. So here's an overview of the model itself. There are 5 elements in the framework, and they are often presented as a cycle beginning with reach, onto effectiveness, adoption, implementation, and maintenance. But I think, similar to the strategic prevention framework, that they aren't really linear. It fit together as a nice acronym that you could say. So you'll see as I talk a little bit more about each element why that's the case. So originally it was developed for consistent reporting of research results, and then later used to organize reviews of existing literature on health promotion and disease prevention in different settings. And then more recently, it's been used to plan programs and improve chances of success in real-world settings. Most of the content in these slides today I took from a manual that was created by a few folks from different institutions, academic, practice settings, research institutions, and then it was supported by the Center for Healthy Aging and the National Council on Aging. That's kind of the origins of where a lot of this material comes from. And the case study I talk about today is actually on working with aging populations. So that's kind of the reference point of where it began. So here are some of the primary questions that you might ask within each of the different elements. So reach is the extent to which a program attracts its intended audiences. So we know that different programs have different reasons that people are attracted to them. So it could be the cost of it, the access, benefits, their familiarity with it, the supports that are provided to participants after they engage. With effectiveness, this refers to a program or initiative's outcomes, and I think it's the one that we're most familiar with. It's kind of thinking about your short, intermediate, and long-term outcomes at an individual population level in some of our cases for environmental strategies. Adoption, this is really similar to REACH, but it refers to the level of a setting. So that might be schools or youth-serving organizations, and it consists of a participation rate among potential settings and representatives of these settings. So what that means is, if you have an initiative that you're rolling out to affect change with youth, yes, your individual youth are the target population that you're trying to affect change in, but they're also the settings in which you're trying to implement that initiative. So it could be schools in that case. There are a range of schools that you might potentially approach and ask to participate in your initiative. So giving some consideration to their participation rate and the characteristics of those schools, as well as the staff who are within them, is kind of the point of this element of the framework. So for me, I like this part of it because I often think we focus on the individual outcomes as kind of the main primary, here's what we're doing, why we're doing it, and here's who we hope to affect, and might neglect considering that adoption piece by settings as a part of our overall calculation of our effectiveness. Implementation is really intervention fidelity, and that's, as we all know, the extent to which different components of an intervention are delivered as we intended. And then maintenance, I think sometimes we think about maintenance in the frame of if an individual sustains the change that we're hoping to affect. So that's a part of it, but it is also the setting in which we choose to roll out an intervention sustaining whatever program or intervention that we initially launched. So it's kind of both things when we're talking about maintenance, not just the individual, but also the setting level. So that's also, I think, a unique feature about this model that gives it some strength. So levels of intervention design. So when we're thinking, as I've just been talking about, the difference between individual and setting, the authors of this framework propose that reach, effectiveness, and maintenance relate to an individual that you're targeting, and adoption of, implementation, and maintenance relate to the setting in which you're rolling out your initiative. And so they're not mutually exclusive, right? When we're trying to think about how to roll out an intervention, we need to think of both our individual level effectiveness as well as at the setting level. So maybe I'll just pause for a second. Any questions kind of on the initial overview of the elements or describing those parts that I did? All right.
No, I'm fine.
Great. All right. So I want to provide an example of the importance of focusing on all of the elements of the framework versus really only focusing on your reach and effectiveness or one or the other. And so say that we've identified a target population that includes students attending 10 schools, and there are about 1,000 students per school, and we want to recruit them to adopt a prevention curriculum. So potentially, we have 10,000 students that we could reach. We've identified these students within our district as our target population, and these schools are the appropriate settings in which we might implement a prevention curriculum. We're assuming that the 10,000 is 100% of our target population. So let's say only 5 of your schools you're able to actually partner with. Now this might be for a variety of different reasons. You know, some schools may already have a prevention curriculum, or they may not be interested in partnering at this time, or they may not have the capacity to actually roll out the prevention curriculum. So an important part is in deciding whether or not that eliminates those 5,000 students from your denominator, your original reach, or are they still included in your overall target population? So maybe those 5 schools just weren't interested, but they also don't have a prevention curriculum. So really, your denominator would still remain at 10,000. Let's say that then only 2 of those schools implemented with fidelity the prevention curriculum. And then after the first year, only 1 school decided to actually sustain those efforts. So potentially, the overall impact for the individuals, without even having measured, you know, those outcomes that you might be measuring for, would be at most 10% of your target population. Then, when you actually look at your outcomes for those individuals, it might vary depending on how many participated within that one school, if you know, the outcomes you were looking at were achieved or not. So I think the point of this example is just to highlight that setting is really important when you're considering your overall denominator for your reach.
Yeah.
So for the case study within the guide, they looked at a partnership between senior center meal sites, or sites where seniors could come to receive a free meal, and then several aging service providers in the community. And they identified low rates of physical activity as an important risk factor for chronic conditions and disability within their community. So data showed that older adult meal site participants reported multiple chronic conditions and led sedentary lifestyles. So as a solution, they wanted to offer structured, evidence-based group physical activity programming. That was kind of their reasoning for arriving at this solution. Additionally, meal program attendees requested physical activity programming, although they did say it needed to be held on site, be age appropriate, safe, free, and taught by experienced instructors. Meal site participants who did not exercise said it was because of pain, fear of injury, and program cost. So they collected some, in addition to identifying a potential solution, some contextual factors around if they were to pursue this programming, what might be most effective as far as access for the target population. So that's kind of what I'm going to be talking about for the rest of the presentation, is walking this case study through to the different re-aim elements. So here are the questions that they needed to think about when they were approaching this. You know, for the reach, they thought, well, who would benefit most from this type of exercise programming, and how might we recruit those individuals? They thought about how would we know if our programming is effective, what sites are appropriate to provide programming, and how will we recruit those sites, so the adoption part. How will we understand if the programming that we implement is actually implemented as it's intended after it begins? And then how will we know if our efforts have been sustained over time, both at our participant level, but also at our setting level? Those were the questions they had moving into this one intervention that they chose. So for reach, as I've mentioned, a key to determining reach is identifying a denominator, but it's really around choosing who eligible persons are for calculating your participation rate. So that means determining what characteristics you'll use to balance your target population. And then that can help you think about what settings would be appropriate for adopting the intervention. So it's kind of, you know, as I mentioned, it's not really a cycle where you do one step. They're not steps, but they're more elements that I think availability of sites plus who your target population is, those both affect your decision making as you're rolling out your intervention. So in this case study, ethnically diverse sedentary adults 60 or older living in neighborhoods without access to exercise programs were identified as the target population and the denominator. So they didn't limit exercise programming to adults with arthritis, but they made a special effort to recruit those adults with arthritis because they knew that they were overrepresented among elders, and they're often hesitant to be active despite proven benefits for elders with arthritis. So they set recruiting targets based on those that they estimated had arthritis. That was their logic behind that. So they wanted to know, well, what % of the target population would participate? So that's the number in % of people in the local population that have a targeted risk factor. For this case study, it was sedentary adults with chronic conditions. And so what % of the population would be appropriate for the intervention? They knew that cognitively and physically able elders would be a part of that group, but those who didn't fit that criteria, weren't cognitively and physically able, might be taken out. So that's important to realize that some, even though they're in your target population, there may be other factors that exclude them from inclusion in your denominator, if that makes sense. So, and then third, are people excluded who are high risk and could benefit from an intervention? So is the population appropriate for an intervention too limiting, or have you tried to include as many as you could? So I mean, that might be a question for them, you know, ethnically diverse individuals in neighborhoods who have arthritis and low access to exercise programs. Is that too limiting for the scope of their intervention? That would be a question they had asked themselves. So I think we largely did this during the needs assessment phase of the SPF, DFS. And we did that, you know, through analysis of existing data to understand demographic characteristics in our communities. We identified high-risk populations in high-need areas, and then doing a scan of existing programs or services to understand gaps in services and challenges with access. That's kind of the ideal of what, for the SPF, we were supposed to go through. So I do want to mention, there was an article that came out on REAIM in 2013, and it was a systematic review of all articles that had used REAIM. And so on each of these different steps, I'm going to mention just kind of some of their findings because I think they're important. And so one of the findings around REACH in this review was that a commonly identified problem in research studies using REAIM was that those studies didn't report eligibility criteria. They didn't report on a valid denominator, characteristics of participants versus non-participants, and they didn't report on recruiting methods. Kind of all of the things that we're talking about that would give you an idea of how you arrived at your denominator, those studies didn't include. So I think the equivalent in this case study would be leaving out details on participant characteristics like residents in neighborhoods without access to exercise programs, their ethnic background, age, or arthritis status. So those are kind of the eligibility criteria that these researchers established for this intervention and noted as well. All right, any questions on REACH?
Are you going to the details about the actual study, like how many actually they determined and percent and all that?
Yeah, yep. I'm going to get to that, and the reason I didn't do it here was because the kind of relationship between REACH and adoption is where they arrived at that number. So when I get to the adoption step or element, I'll talk about the overall numbers.
Okay.
All right, so for effectiveness, you know, as I mentioned, this is the bucket that many of us are familiar and comfortable thinking about. It includes our process measures, short, intermediate, long-term outcomes. And I think we naturally gravitate as evaluators to thinking about these. And so for this case study, for outputs, they thought about performance measures and attendance as a way to get at effectiveness. And then for outcomes, they thought about quality of life indicators, changes in overall physical activity, and health status. So those were the kind of short, intermediate, and long-term outcomes that this study looked at. Again, referring to that systematic review article, for effectiveness, a common problem was not reporting measurements of short-term attrition away from a program or an initiative, or differential rates by participant characteristics. So, for all of these common problems, I'm sure there were contextual reasons why researchers maybe didn't have the resources to include everything within a given study. So just kind of listing them because they're maybe good to have in the back of your mind to at least have a reason why you couldn't include them, or maybe you hadn't thought of it and should include some numbers around these. Another common problem with effectiveness was not reporting on broader effects like quality of life or unintended consequences, which we know can be hard to get at. You kind of choose what your indicators are and then you collect data on those indicators, but you don't necessarily learn about unintended outcomes. And then another problem was measure a primary outcome relative to a public health goal. So I think they mentioned, for example, alignment with something like Healthy People 2020 or some other national initiative that you could tie it to. Right. So the next element is adoption. So similar to determining reach, a key to determining adoption is identifying a denominator of eligible sites. So eligibility criteria for this case study, they were sites that served ethnic or racially diverse groups. They had previous experience with this kind of programming around exercise. They had the appropriate space and equipment, accessible to older adults, of course, and then they had some experience recruiting and managing volunteers. So partners met with a variety of local aging and public health organizations and learned which neighborhoods they served and which older adults participated in existing programs. And they decided to start programming at meal sites in neighborhoods with large ethnic populations and few physical activity programs because they felt the chances of success in those neighborhoods would be greater. They didn't exclude sites that were outside of these criteria and inquired about the programming, so rather they consider those case-by-case basis. It's important to note that the 15% potential sites that declined for various reasons, including, so let me just say first that 20 sites were reviewed based on these criteria and that 5 were quote unquote appropriate and willing. Of the 15 that chose not to participate, 5 were not interested. 5 were interested but couldn't do it now. 4 didn't have suitable space. 4 preferred their current exercise class, and 2 were not interested. So I think this is important in determining your overall denominator for reach, and I'll show it's kind of one of my rubs with this case study is that they didn't do it that way. They only included the 5 sites as their denominator. So here's what they did. So at meal sites, those 5, they estimated that there were 250 sedentary adults. They didn't specify data source for estimate, but maybe they used administrative records at meal sites or aging facilities. They determined that 80% of those individuals had arthritis, and so they set a goal of 40% or 80 individuals for recruitment. Right, so that was at meal sites. They also wanted to reach not just those who attended meal sites, but at a larger level. So they found out how many other people were connected with each of the sites. And so it was estimated that about 20 people per site for 100 total were connected with each of the 5 sites. So they said, well, about half of those have arthritis, so we'll set a goal of 20% or 10 additional people who will participate. And for determining that, they actually use census and risk factor data to have an idea of how many sedentary older adults with arthritis were residing in the neighborhoods around each of the sites. And then not connected to at all, this would be within the neighborhood generally, 500 people. And using previous research, about half of those likely had arthritis. So they set a goal of 10% or 25 additional people. And so that's a total of 850 sedentary adults living in their targeted areas, the 5 sites. So with arthritis would be about 500, and that would mean that their target goal for these programs would be 115 or 23% of their overall target population. So, I mean, I think there's room for discussion in a few places. One would be kind of the decisions you make around data that isn't absolute or exactly the number. So you're using your professional experience, relying on other experts who have worked in these areas to help you with to make an informed guess as far as estimates of numbers. And the authors admitted that, you know, choosing that about 50% of the 500 live with arthritis, they don't know that for sure, but that was their best guess. So my question really was, what about the target population that they missed in the 15 sites who chose not to? To me, the estimate should have been produced for how many individuals with arthritis live in those neighborhoods, and those totals should have been included in the denominator. So I think that was a shortcoming of the case study. I realized that the 4 sites that already had exercise programming, maybe you don't include them, but that means that you have 16 potential sites that didn't participate. So that to me would have dropped their overall number as far as recruitment down even further, potentially to an impact of 3 or 4%, depending. So you can see how kind of whether or not you include your target population from sites really impacts your overall reach when you're thinking about your target population. Any questions?
Did any of the articles speak to that, Peter? So I mean, is it something where as long as you're doing it consistently and you're not comparing across interventions, I mean, is it okay to have variation in how you're calculating that?
Right.
Did any of them, I'm just curious if any of them talked about it.
I mean, so in some of the other studies I looked at, they calculated it in the way that I mentioned as far as including potentially your entire target population.
Sure.
Then you're looking at sites to choose from. So, so I would lean towards you're really trying to get a sense of your overall impact, and you've bounded your target population. That is set regardless of whether sites participate or not, unless in the case like this, they already have an exercise program or they already have a prevention curriculum. That would be different. I would think that would be a reason to leave them out of your total count. So what do you all think?
I like how you presented on this particular page. It's very smart.
So any thoughts on, as far as when you are calculating your total denominator for reach in an intervention, do you only include those that are from sites that you've targeted? So I think in a lot of cases with our work, we have pilot schools that we're working with. So we've chosen 2 pilot schools or 5 pilot schools because they're probably willing to participate and partner. So is your denominator set at that students from those schools, or should it really include whatever characteristics of your target population at a wider level within your county?
I mean, I think you have to take into account that there's going to be spillover into the community surrounding the school, and that you might reach additional people surrounding the area around that school and the community, because people don't just stay in one spot all the time. Even if you're delivering it, it still might have an effect on people outside of that school, I think. And I think that's something that we've been struggling with, determining for certain things exactly how to do our reach that we're going to have at different schools with different staff and the community.
Yeah, that's a little harder to get at the most likely.
And I'm glad you summarized it with the idea of diminishing effect, because it just dawned on me that doesn't matter how much we want to move the whole target population, we can always just impact a small pocket of people. And hopefully that will just set examples and examples and examples. And like Aaron says, you can actually spread out, but however, hopefully people would learn it and then adopt it as a culture later, after so many times that we try.
Yeah, I think that's a good point. I mean, one of your eligibility criteria might be that you're trying to pilot it. And so that's the reason why you choose 2 schools, to show effectiveness within that bounded population, or at least learn about how it goes. So maybe it's a part of recognizing limitations, but also acknowledging that because we chose only 2 pilot schools, we did in fact only reach 2% of our target population, or 3%. I think that could even be a reason to say, well, it had some success, but look at how small of a sample of the population we actually reach, like this is a reason why we should really expand this. So I think that can be impactful for potential partners to see, you know, there is still a huge proportion of our intended population that we haven't reached yet. So there is still work that can be done. All right, so a couple of common problems, you know, that were highlighted in that systematic review around adoption would be not reporting the percent of settings that were approached that participated, not reporting recruitment of setting details and exclusion criteria, so only picking your optimal sites, not reporting characteristics of the staff participants versus non-participants, so I think that's important too, who's actually delivering whatever programming or intervention that you have chosen. And then not reporting on recruitment and exclusion of staff characteristics. So why did you choose certain staff who are eligible to deliver the intervention versus those? So more details kind of on the programming side of things that could impact fidelity, could also impact overall maintenance. So they're kind of the details underlying that can be important to understand to be able to maintenance as well as implementation. All right, so recruitment. This is a part of, as we know, both adoption and reach. So there are quite a few different ways, strategies for recruiting potential participants or sites. This case study, they used a variety of marketing materials and channels, including presentations to groups of older adults, newsletter and local newspaper announcements, flyers in local clinics, pharmacies, grocery stores, libraries, and other places frequented by older adults. They asked older adults with arthritis to participate in presentations as well and share their stories in local news outlets. So to really increase the likelihood that they would achieve their recruitment targets, these were the methods that they employed to try and achieve that. So it turns out that their recruitment in this case study really did pay off. They had 180 individuals sign up, and 150 of those had arthritis. So for them, they felt they reached 30% of their target population. So that's going back to their total target of, I think it was 115 or 20% of their target population. So for implementation, attendance was taken at each of the sites and the classes. Classes were offered 3 times per week per site, and 70% or more, 70% attended 2 or more times per week. And for those who attended less and were unable to attend, it was because of a lack of interest, conflicts with days or times, and unexpected health problems or health of their friends or family. 2 courses were offered per site, which should have equaled 10, but due to circumstances like change in staff, lack of space, increased interest, and addition of an extra course, there were a total of 9 courses offered. And then for the quality of classes, they had a manager at each of the coordinating agencies visit a class to monitor the instructions, and they occurred within the instructor's first month and then every 6 months afterwards. So one instructor with a class of 14 required additional training, and a master trainer worked with that person to improve their skills. So due to that delay, it's likely that those 14 participants didn't receive full benefit of the classes in the first 6 months. And then an additional trainer was terminated after failing to maintain program fidelity. So these were kind of, for fidelity, the 3 approaches that they took to ensure that the exercise programming was implemented as intended. So some of the common problems identified with implementation and other research studies were not reporting adaptations made to the intervention during the study, not reporting on the costs and resources that are required, and not reporting on differences in implementation and outcomes by different staff. Depending on how many sites you had or how many people that could be difficult to do, or again, that's kind of maybe the ideal. For maintenance, so this is really, as we had mentioned, defining it as both an individual and organizational level support. So sustaining changes at the participant level, as well as organization institutionalizing interventions over time. In the case study, we hope, or their hope was, that individuals would sustain attendance and performance measures, as well as changes in their overall physical activity, their quality of life would improve and be maintained, and then their health status would improve. So for the sites who were offering the program, it was continuing to offer that programming and maintaining fidelity. Then the case study offered some ways to support both individuals and sites with maintaining your intended outcome. For them, it was supporting individuals by allowing modifications to the aerobic component. So based on ethnic group, one group might choose dancing and another might choose walking. So kind of allowing, while maintaining fidelity, for some adaptation to be made. Providing feedback about improvements in their muscle strength, balance, based on their performance measures, provided by instructors as a means of promoting maintenance. And then ongoing support to site staff. So I think, as you probably know in your work, that there's a hesitation sometimes for sites to agree to partner based on not knowing what it'll take to actually roll out an intervention. So identifying what resources and capacity are needed and being able to support those who are working with you. So other possible indicators of maintenance that weren't included in the case study might include sustainability of actual resources to provide the intervention or expansion of it. And then in terms of a policy change, we might think about continued enforcement or modification of a policy. Additionally, for this case study, participants completed annual written surveys that assessed the maintenance of the desired outcomes. And then for site level maintenance, instructors had access to updated program info, attended an all-day workshop annually, and then were able to contact the program manager for additional support or assistance. They found that after 12 months, 60% of enrollees were still exercising, and many more individuals had enrolled and new sites had been added. So what is 60% of 150? 110, something like that. So that's about the impact overall when all is said and done a year out after rolling out an intervention, given that their initial target population really was only those 5 sites. So it's just an interesting kind of way to zoom out and think about overall impact after you've defined your target population, and then you're a year in and you actually realize how many are continuing to receive or maintain whatever intervention that you proposed. So some of the problems from that review with the maintenance phase at an individual level was not reporting results of long-term broader outcomes, quality of life or unintended outcomes. That's the same as we saw with the effectiveness problem. And then for the setting, it was not reporting if a program was still happening after greater than 6 months later. And then not reporting on how a program or policy was adopted. So yeah, I know that's been another area where for us, an indicator for policy changes was the policy adopted, yes or no. So kind of moving beyond that to say, well, how was it adopted and how was it maintained? How was it implemented as well? The other phases. So that concludes just the overall presentation on the framework and the case study. So coming back to some of the questions that we initially posed, what were your overall impressions?
I mean, I think I can definitely see how it would be useful for thinking about some of the things that we've been looking at implementing. My one thing would be, I don't know how it would be so useful because we've kind of changed directions from doing like training in the 28 different schools just because there's so much change going on in them, to partnering to doing a conference. And so seeing the maintenance from doing a conference about trusted adults doesn't seem like it would be that feasible unless you follow up with the teachers about how they're implementing different things and have a conference every year that they can attend on that. But
I wonder if you could think about, so as far as your target population, it's a certain number of individuals from those schools to attend, right?
mm-hmm.
And your setting are a certain number of schools who would attend, I would think. So you could potentially determine the ideal number that you want to recruit from each of those different schools and actually compare those with on conference day who attends from the different schools and who those individuals are, to at least know whether or not you've missed some of the schools. Schools only have 1 or 2 participants versus your intended 10. So that's how I can think of reach and adoption
Mm-hmm.
before the conference even begins.
Yeah. But I think, but I think it could be useful for a lot of the stuff, and even talking through with the coalition about all of that, the different steps, and having them help think through it. I think it's kind of a more tangible way to think through different ways of evaluating things for coalition members and people who aren't in it all the time.
I agree with Erin. I think it's good to make the, if you allow me to say, it's implicit structure, but it's explicit. And then when we, as the evaluator, aware of the structure, it's easier for us to follow and to point it out to people. And from this particular case study, I like how they do to ensure the maintenance part, the annual follow-up at the individual and the organizational level. And I think that's something that, we kind of are doing, but we don't actually, it's a vague concept, but when you point it out like this in a framework, it is helpful. And it's easier for us, for people to talk about it.
Mm-hmm.
Yeah, it might encourage, just some conversation around what characteristics you're even considering for eligible sites, to document those, to have some reasoning behind it other than just informal conversations.
Exactly.
It's a way that I thought, it could be useful.
So yeah, it's overall useful. As long as
and I understand that, this is a really bounded program. It's a specific program. It's easy to wrap your head around. I think that's why they used it as a case study, because it really does highlight the different steps fairly straightforward. But I've been thinking, our coalitions are doing 3, 4, 5 different strategies. The strategy types are different, from information dissemination to educational to environmental. So I think I'm kind of jumping ahead, but I'm curious how you might think about using this model in your work. We heard a couple of kind of narrow focus, but thinking about it globally, could you use it globally, or would it be more, it would fit on a specific strategy and you kind of run through the framework on each strategy? I don't have an answer. I think it's just to think about.
I think using this framework helps us to present the case more structurally, and also help us point us to where to evaluate. And then again, I like the way that you look at evaluation of individual and organizational level. So I think it's helpful.
I think it might even help with thinking through certain aspects of when we're applying for different grants, when we're thinking about the programs that would go along with those grants, of some of the requirements that they are going to want to know. I can see this being useful for walking through some of that stuff too.
And like Peter said, it's straightforward, it's simple, and I like it. But it's inclusive. It covers the whole circle of steps. And it tells you the percentage of your target population, you know. So that is good.
Yeah, in a way, it forces you to document who are you including or not when you're trying to recruit, because there's the idea of, well, you're just trying to do the best you can with partnerships that may already exist, or relationships that already exist, and that's fine. But I think that's different than defining a target population based on a risk factor and data that shows you how prevalent that risk factor is in your community. So, yeah, sometimes it's easy to kind of lump those in and just say, well, we're going to largely lean on our current relationships as far as where we look for appropriate settings. So.
Mm-hmm. And at the same time, when you're reporting about your even 15% or 10%, at the same time you're reporting, well, this other schools have already been doing this and that. You know, that part will come out too. So that is actually good if we're talking about a collective impact. It's not just we come up with this genius idea and only this would work. You know,
right. Yeah, that's a great point. It kind of forces you into also considering your resource assessment. You need to identify of those sites that are potential already is work that you might complement, and then you actually document that. So that's a great point. So I'll mention one other article that I did look at. It was applying REAIM to a more complex regional partnership, and they chose to do kind of different levels of reach, so local, regional, and nationwide, which I know is way larger than us. For adoption, they also did different levels of adoption, but I think it's also important to think that, yes, this framework is kind of straightforward if you think about applying it to one strategy, but if you have a partnership that has multiple strategies or multiple different partners involved, you might consider how you adapt the framework as well to be a little more nuanced. So I think in the case for an information dissemination strategy, they only used reach and effectiveness. They chose, based on the nature of the intervention, that it wasn't appropriate to try and run it through the standard model. So, yeah, I just thought that was interesting and relevant to our work, because we're not doing specific program-like change in every instance. So I'm curious, just thinking about this with policy in mind, how might you apply this framework to a policy intervention?
I think you'd have to think about whether it would be a state level policy or a local level policy, because then that would affect your adoption of, since we have so much local jurisdiction in Colorado, then does everyone adopt that policy there that you have? your reach would be. Is it only going to affect a certain part of the wherever you are?
Yep.
I think it's a little more nuanced thinking about it with policy. And your maintenance would just be, is it, because sometimes some of the policy stuff is like sunset clauses, and whether it gets maintained over time or if it's actually enforced as part of the maintenance as well, I think.
Right. Yeah, and that makes me think of implementation. I mean, is that where, for a policy, when you're talking about fidelity, is it, let's say you had a county adopt a policy that was supposed to be carried out within each law enforcement agency across the county, would it then be looking at which sites adopt, not only adopt it, because I think they by law would have to adopt it, but then your implementation might be looking at to what extent they enforce each of those policies in the different law enforcement jurisdictions.
Mm-hmm.
So yeah, that's a good point. Like how is, and maintenance maybe is the continued enforcement over time and maintaining.
I am, sorry.
Yeah, go ahead.
I was just wondering, even though many of those implementation are based on evidence-based programs, I almost feel like we have to see the impact on our local study to be more convincing to the policymakers that to include this, unless of course something that is legal already. Otherwise, we have to persuade them that this actually is working locally also, not just a wonderful evidence-based program somewhere else. So I'm thinking to form a policy could be after the implementation, I don't know, right? Or at least for a short term.
Yeah, I think I know what you mean. Do you mean as far as like programming that would support the passing of a policy?
Right.
Is it like Project Respect? Is that what you're thinking about?
Right. So we are more convincing that this is important. We really need to make sure this is at the organizational level that we should enforce this.
And that's, you know, that's kind of how I've thought about as far as policy. It seems a lot of folks are working with schools or school districts. So to me, you know, your target population is the youth in those schools, and then the sites would be the schools who choose to adopt a policy or not. As we know, even at district level, if there is a policy, the way it's enforced within a given school can vary greatly by principal and by district if they allow their principals to kind of set the tone for whatever policies exist. So yeah, so I could see when, yeah, there's a part of like if you were applying re-aim just to the program side of Project Respect as far as working with individual students, gathering data to then start the process of recruiting sites, and yeah, that would be kind of another start of this framework in the policy realm. Yeah. Well, any challenges that you perceive in using this framework in prevention?
I think actually it's all overall helpful.
I'm not sure.
Yeah.
In some ways, I think it's hard because some of the work that the communities are doing aren't nearly as bounded. So I think prevention work in general isn't often as bounded. It's more, it's not as bounded as an intervention, just by the nature of the work. And so I think that presents a challenge, but I think there's still a way to adapt the model for that.
Yeah.
I think it might be more applicable in places where you do have a more bounded prevention strategy than some of the broader work that some of the communities are doing?
I think it's because it's general enough so that it actually helps you organize your action and your thoughts rather than limit or present challenges. That's what I really feel.
Yeah, that's great news. That was kind of, I didn't have necessarily a specific idea in mind. I was just curious as you all had listened. Sometimes you listen and you hear about a model and you're like, but that one thing would be really difficult in our situation, or that aspect that I just don't agree with. But, all right, well, I have just a couple of final additional slides, and these were calculations that you could use to estimate reach or calculate reach. And so on the left there, you have 5 different calculations. And this is where I think, too, these were offered by the same authors. For me, estimated target population and number of target population were eligible. They didn't give a lot of background on how they defined those. So I almost believe that you should determine your criteria for eligibility and then decide how many are in your target population. So I'll just throw that out as I found. But here on the right, you'll see the formulas change. So percent of eligible who participate is D divided by E. Percent of reach into your target population, E divided by A. Percent excluded from your intervention, A minus B divided by A. Percent participation among the eligible, B divided by A. I mean, I guess you might consider your target population, like in that case study, it was sedentary adults living with arthritis who were ethnically diverse and lived in neighborhoods without access to exercise programming. You could say, well, that's A. And then you could say that those who were not cognitively or physically able might still have fit all those criteria, but are included in basically your A minus D. So I guess that's one way to think about it if you come up with additional exclusion criteria after you calculate your population. And then these are a couple of the references that I talked about today. So we'll post the slides to the website as well as the video. And then there was one additional kind of page checklist that the authors put together that helps you assess the quality of how you're implementing the framework. So that could be beneficial if you are thinking about using this to apply to your own work. I'm going to go ahead and hit stop. All right, so I guess any final thoughts that anybody wants to share? That's all I have.
I think it's great. I like it.
Good. Right. Well, we'll put those resources, and yeah, you can, maybe in a follow-up email, I'll send them out as well. If you couldn't participate, we'll have them, access to them. So thank you too for being on the call.
Yeah, thank you.
Thank you.
Have a great weekend.
All right.
Okay.
Okay.
Bye.